Hello everyone, welcome back to my channel. So in this video, let us see about the nursing research questions. First one, review of literature is a systemic way of presentation of relevant references along with brief findings in the specific juncture for the proposed study or research proposal. Here, it will give relevant references along with brief findings. They are of two types, primary sources and secondary sources. Primary sources provide the first-hand evidence about event, object, person or work of art. Whereas secondary sources describe, discuss, interpret, comment upon, analyze, evaluate, summarize and process primary sources. Next, abbreviation of CINAL, Cumulative Index to Nursing Allied Health Literature. Next, a variable is a measurable characteristic that varies. There are different types of variables. First one, dependent variable. These are the variables which changed according to the independent variable. For example, a study to assess the effect of hand grip exercises on BP of prehypertensive client. Here, dependent variable is BP of prehypertensive client. Next one, independent variable. These are the variables manipulated by the researcher. Example, study to assess the effect of hand grip exercises on BP of prehypertensive client. Same example, but here the independent variable is hand grip exercises. Next one, continuous variable. It can take an infinite range of values along a continuum. Example, weight in kilograms. Examples, independent variable, teaching style, dependent variable, exam performance of the students. Next one, hypothesis. The expected relationship among two or more variables under study is called as hypothesis. There are different types of hypothesis. Simple hypothesis, it is one which explains the relationship between two variables. For example, same example, hand grip exercise among prehypertensive client help to decrease the BP reading. It is helping to decrease. So here are the two variables. Whereas complex hypothesis is one which explains the relationship between more than two variables, like knowledge regarding newborn care is higher among the nurses who all are working in labor room and having more experience than the nurses who all are working in another area. So here more than two variables you can find. Directional hypothesis. It not only specify the existence of relationship between variables but also specify the direction of relationship between the variables. For example, nurses with good knowledge regarding organ donation have positive attitude towards organ donation. In directional hypothesis, it can be positive or negative. Whereas non-directional hypothesis, it only specifies the existence of relationship between variables and it does not specify the direct of relationship. Example, there is a relationship between knowledge and attitude regarding organ donation among nurses. So knowledge and attitude. Associative hypothesis. It explains the relationship between the two variables in natural setting without any manipulation, like lower level of hemoglobin level, then higher the incidence of infection among the cancer patients. Causal hypothesis. It explains the cause and effect of relationship between two or more independent and dependent variables, like prevalence of ventilator associated pneumonia is less among the patients who all are receiving oral care using betadine as compared to the patient who all are receiving oral care using hydrogen peroxide. So it explains the cause as well as the effect. Research hypothesis. There is existence of relationship between the variables. For example, there will be positive correlation between LDL value and systolic blood pressure of adult patients, whereas null hypothesis, there is existence of no relationship between variables. For example, there will be no correlation between the blood cholesterol levels and blood pressure of the patients. Now, next topic is research designs. There are two types of research designs, A. Quantitative, B. Qualitative. Again, in quantitative, we have first one experimental and second one non-experimental. Under experimental, we have true, quasi and pre-experimental, whereas in non-experimental, we have descriptive, survey, correlational, methodological, comparative. So this all comes under quantitative research designs. Whereas in qualitative, we have grounded theory, phenomenological study, ethnography and case study method. So we need to know what comes under quantitative and what comes under qualitative. Quantitative research, the variables which are measured and it can be quantified, whereas in qualitative research, variables are not quantified. Next we have Q-sort technique, which involves sorting a deck of cards according to specified criteria. Next we have Delphi technique. These techniques will come under qualitative research. Delphi technique, it is used to measure the judgments of a group of experts for the purpose of making forecast. And there are of three types: classic Delphi, policy Delphi and decision Delphi. Classic Delphi mainly it focus on reaching on consensus, whereas policy Delphi to identify and understand a variety of viewpoint. Decision Delphi panel consists of individuals, they are helpful in decision making. Next we have a Likert scale. It is an ordinal scale format that asks respondents to indicate the extent to which they agree or disagree with the opinion expressed by the statement. So it will ask the respondents whether they are agreeing or not, and it is also called as a rating scale. Semantic differential scale, it measures attitudes and beliefs, for example whether it is effective or ineffective. And last one we have visual analog scale. It is used to measure subjective experiences of the patients such as pain, fatigue, nausea and dyspnea. So this is for today, and if you want me to upload other videos, please subscribe and like my videos.